Hello, I'm Dr. Thomas Park, spine surgeon with HCA Capital Hospital in Tallahassee. We'd like to welcome you to one of the 100 best hospitals in the country for spine surgery. The hospital has invested a significant amount of money in advancing technology and making us the best hospital in the region for your spine care. The hospital staff is excellent and has received an A grade in safety rating. You will receive excellent care here from the administration down to the nursing staff. We look forward to welcoming you here for any of your surgical needs.
Hi, welcome everyone. This is a spine education class to help prepare you for your class and education on your spine surgery here at HCA Florida Capital Hospital. At HCA, it is our responsibility to make sure you are well prepared for your surgery so that you have successful outcomes after your procedure. This is your spine education booklet. So this booklet will actually help guide you before your surgery, after your surgery, and help you with recovery. So it'll remind you of things that you need to do at home to be successful. So you will actually receive this booklet at your pre-admission testing appointment, and it does have some areas in the back of the booklet that you can actually write notes when you go to your provider's office. If you have any questions that you would like to ask them, it's a good opportunity to put that information in there so that you can have it with you. But it's a good thing to carry around with you to medical appointments and also to your hospitalization. So just keep it on hand and carry it with you. So our goal is to provide you with a team approach to guide you through your surgery and recovery. The most important part of your team is you. Your commitment and cooperation are vital to a rapid and successful recovery. So the biggest part of this surgical procedure and being successful is you. So here are two of our spine surgeons here at the hospital. We have Dr. Thomas Park and we have Dr. Matthew Lee. So they both are specialized in the procedures that they perform at the hospital, and they are going to be very big and important on your recovery process. So who is a part of your team while you're here at the hospital? You also always have your orthopedic director, manager, me, the spine navigator, your RN, your LPN, your assistant staff, including your PCT and CNA, your medical provider, your physical therapist, your occupational therapist, if ordered, your case manager, your pharmacist, your dietitian, and your environmental services that will help keep your area clean. Your responsibilities as the patient. You want to read and follow your preoperative instructions very thoroughly. It's very important to follow those closely. Use the patient handbook, as we spoke of, as a guide through every step of your surgery. Most importantly, ask questions. If you don't know something, please ask. I'm always available. You can text, call, email. So most importantly, if you have any questions, please do not hesitate to reach out to me or any member of your team, as we will guide you through this procedure.
Hello, my name is Lisa. I'm one of the registered nurses here at HCA, and today we will be discussing pre-admission testing and what to expect. Where do you arrive? TOC schedules your pre-op appointment with HCA. TOC or HCA will notify you of your pre-op phone and or in-person interview. If you have any questions or have not been notified of your pre-op appointment, please call 850-325-5376. Where do I go? You will arrive to the front entrance of HCA Florida Capital Hospital. At the front desk, there will be a security guard that will direct you from there. What should you bring? Government issued ID and insurance card, any provided paperwork from your doctor's office, a list of your current medications, any cardiac records, for example, EKG, echo, stress test. What can you expect from your pre-op appointment? Well, your pre-op appointment can last up to 2 hours. The nurse may call you at home. When you do arrive to the hospital, she will get, or he or she will get weight and vital signs, possible urine specimen collection, lab collection, obtain a formal consent for the procedure, chest x-ray if it's indicated, an EKG if it's indicated, medication review, obtain medical history, pre-op instructions will be reviewed, nasal swab, pre-op surgical wash with instructions, and answer any questions or concerns regarding your procedure. For example, some medications to stop. Medications such as diabetes medications, for example, glimepiride, metformin, blood thinners. You'll stop taking blood thinners such as aspirin, warfarin, Eliquis, ibuprofen, naproxen, Plavix. Your physician will instruct you on how many days prior to stop these medications. Water pills and diuretics, examples, furosemide, spironolactone, Bumex. Continuing taking blood pressure medications. For examples, amlodipine, metoprolol, carvedilol. On the day of surgery, arrival will be 2 to 3 hours prior to your scheduled procedure time. The time will be provided by calling this number, 850-325-4571 after 6 p.m. the night before your procedure. On the day of your procedure, you're going to proceed to the second floor and check in with surgical waiting room secretary. At the time of your pre-op, they will start an IV. The nurse will come in and greet you, start your IV, review consents, and verify information from your pre-op appointment. Multiple verifications of identity will be confirmed throughout your hospital stay. You will also meet anesthesia and they will interview you as well. The surgeon will arrive and evaluate, mark the site, and answer any last-minute questions. You will be monitored in the pre-op bay until surgery with one family member allowed. You will be introduced to your OR team and escorted to your operating suite. At that time, your family member will be in the surgical waiting area and they will be provided with updates on your surgical progression. If any surgery times are updated, you will be informed promptly. Following surgery, you will be recovered in the PACU. Following recovery, you will be taken to same-day surgery for same-day discharge, or if you will be staying overnight, you will be given a room assignment.
Hi, I'm Naja Javier, one of the physical therapists here at HCA Acute Care Physical Therapy Unit. And today I'm going to discuss with you the importance of physical therapy after spinal surgery. Let's get started. Physical therapy plays an important role after spinal surgery. We want to promote early recovery after your spinal surgery. And as I always emphasize, walking is the best exercise. So early mobility begins operative day. We educate our patients on how to safely move from bed to sitting position to standing and eventually walking. We use an assistive device called a two-wheeled walker in order for the patient to walk safely. So from bed to walking. After spinal surgery, we promote hip precautions. We follow hip precautions and we call it BLT after surgery. No BLTs after surgery. No forward bending, side bending, or backward bending at your spine. No lifting more than a gallon of milk, and no trunk twisting. Always keep your head, shoulders, and hips aligned when doing your functional activities. Back brace. Bring your back brace if it's to the hospital if given preoperatively. Back braces are ordered by a case-by-case basis. Physical therapy evaluation requires back brace if applicable. It must be worn when upright more than 5 minutes, standing, or walking when you're sitting in a chair. Back braces promote proper body alignment in order for you not to break your spinal precautions. We have adaptive equipment that we use here at the hospital. We have sock aid that helps the patient when they put on their socks. We have grabber that helps patient when they need to reach or pick up something on the floor. and long handheld shoehorn in order for our patients to put on their shoes safely. So overall, we would like you to see here at the hospital after your hip surgery, and we will help you recover faster.
Hello, my name is Jacob. I'm a social worker here at HCA Florida Capital Hospital with the Case Management Department. Case management's role in your plan procedure is that of the discharge planner. So me and my team will follow every step of the way from before you come in for your procedure, throughout your surgery, all the way up to the time of discharge from the hospital. Me and my team help with coordinating any sort of follow-up services that may be needed post-operatively for our surgeries. For most of our planned spinal surgeries, TOC, your surgeon, will plan for you to discharge home without any additional services or any additional equipment needs. But after you have your procedure, you will be evaluated by physical therapy. And if therapy, after working with you, suggests that you might need a piece of equipment or an additional follow-up service such as rehab or home health care, somebody from my team will help coordinate those things and make sure that you have all of the equipment and services that you need to discharge from the hospital safely. You can expect to get a call from somebody from my team usually the day before your surgery, or if your surgery is planned for a Monday, you'll expect a call from us the Friday before your surgery. And when we call, we are just calling to check in and verify basic information, make sure we have demographic information correctly, make sure we have any pre-planned services set up correctly, make sure we have emergency contacts on file correctly. Once you're actually in for your surgery, if you do plan to discharge same day, you'll likely not see anybody from me or my team. We tend to stay behind the scenes to work to make sure that everything is arranged for you by the time that you discharge. But if for whatever reason you are admitted to the floor or you do need to move up to the floor to stay a day or two with us, either myself or somebody from my team will be checking in with you once you're admitted and following up with you and with the rest of the medical team for any post-operative needs.
Hi, my name is Veronica and I'm one of the dietitians here at HCA, and I'm going to be giving my talk on nutrition. So first things first, we're going to be trying to focus on planning ahead for after surgery. So kind of having things on hand such as crock pot meals, maybe making a meal and freezing it so that you have it after surgery. Having some quick snacks on hand such as nuts, yogurt, fresh fruit, carrots, or broccoli can be really good to have something to snack on after surgery that's kind of easy and quick and gets you some good vitamins and minerals. Another thing that might be helpful is something such as a supplement. So some common brands are Ensure, Boost, Glucerna, protein shakes. These are kind of easy things to have on hand that you can sip on throughout the day after surgery if you're not feeling too up to eating or cooking a full meal. Next, we're going to be talking about post-surgery. What are some things that you might want to keep in mind? So you might see that your doctor has you on a diabetic diet after surgery. We're not telling you you have diabetes. This just sometimes after surgery you might have elevated blood glucose levels because of stress and other certain medications, and this will normalize and will put you back on a regular diet afterwards. Another thing we like to have you keep on mind is that we have certain things on the floor for you to have in case your throat is sore, such as soft items like pudding, applesauce, some popsicles to kind of soothe your throat if it's feeling a little sore after surgery. And once again, this is something else that's going to normalize afterwards. Something else is there's certain food items that can be helpful with controlling inflammation and after surgery. And so I have a list here of different food items that have been shown to help with fighting inflammation. I always like to say, if you see things on this list that you already have in your diet and that you like, maybe trying to increase them a little bit after surgery is going to be helpful. Or maybe there's a food item that you see that you've never tried before and you're interested in trying. So maybe trying that after surgery could be helpful. If you see something you absolutely hate, I'm not telling you you have to eat it. It's okay. So some example of foods that have been shown to help fight with inflammation are things such as fatty fish like your salmon and tuna, nuts such as almond and walnuts, flaxseed oil, onion, garlic, dark fruits like plums and berries, and turmeric. Another thing we want you to keep in mind post-surgery is getting enough fluids and fiber. This is going to be really important to make sure that you're having regular bowel movements and not getting too backed up. So things that have fiber in them are things such as whole grains and fruits and vegetables. So post-surgery, making sure you're getting in some good whole grains and some fruits and veggies can be really helpful with keeping you regular. Another thing is trying to get enough water. So our general recommendation is 2 liters of water a day. This, of course, is only if your doctor hasn't put you on a fluid restriction or anything like that. Always listen to what your doctor says. Something else that can be helpful, even if you do all of the things I've said, sometimes having a stool softener on hand can be good, just in case. We don't want you coming back here because of constipation. Something else is after surgery, what are some good nutrition tips to keep in mind? So one is getting enough protein foods. So high protein foods are going to be high in zinc, which is really good for fighting infection. Protein, of course, has some essentials for maintaining and rebuilding muscle, so it's going to be really important after surgery to make sure you're getting enough protein. Some foods with protein are going to be your different meats, your poultry, dairy, eggs, fish. If you're not a big meat eater, there are some sources of non-animal foods such as nuts and seeds and tofu that contain protein. So sometimes we try to get enough protein and maybe you're just not feeling up to eating a full meal. This is when the things such as the supplements like an Ensure or Glucerna can come in hand to try to get a little extra protein in. You can even make your own shake at home, such as a smoothie, and add things with protein such as Greek yogurt, or you can use milk as a base, and this can get you some extra protein as well in a really quick way. Something else, like I said before, is if you do have diabetes, then kind of trying to keep your glucose controlled to avoid delays in wound healing. Here you want to pay attention to carbohydrate portions and then also include in whole grains for extra fiber as well. And it's a dual effect. It's also going to help with keeping your bowel movements regular. Another thing is maybe trying to get some low-fat dairy in post-surgery. So this is going to have some really good vitamin D and calcium that's essential for bone healing. And then also just trying to get enough fruits and veggies. So the general recommendation is to get 5 per day. And so this is going to ensure you're getting enough vitamins and minerals and vitamin C. And it also, like I said prior, has that fiber in it that's going to help keep you regular.
Hello, my name is Renee Jackson. I am the nurse manager at HCA Florida Capital Hospital. Our orthopedic unit is an 18-bed unit with all private rooms. This is a feature that sets us aside from other hospitals in the area. We provide 24-hour nursing care around the clock, which consists of a nurse leader rounding, which will be provided by myself. In my absence, a clinical nurse coordinator will be overseeing your care. This is primarily at night and on weekends. We provide 24-hour nursing care around the clock. Your nursing care team, direct patient care team, will consist of a clinical nurse coordinator, a primary RN, and a patient care technician. Care around the clock includes bedside shift reporting. Bedside shift reporting occurs at the change of shift with the outgoing nurse and the oncoming nurse meeting with you at the change of every shift to discuss your plan of care and your goals for the day. Our unit has a reputation of providing exemplary patient care as evidenced by our patient experience scores and patient feedback. Our patients rave about the nursing care and communication on the unit, the cleanliness of the unit, in addition to the professionalism of the entire nursing team. Thank you for choosing HCA Florida Capital Hospital and allowing us to provide you with a great patient experience. It's our ultimate goal to provide safe, quality patient care. Thank you for choosing us.
Hey Hey, Casey again. I just wanted to go over the nursing portion of your postoperative care. So if you are admitted to the surgical services unit on the 5th floor, which is rooms 540 to 557, and you wear a CPAP, you will want to make sure that you bring your equipment with you. It is very important that it is specialized for you and is specialized to fit you. So we will utilize that on the floor. If you are a same-day surgery patient, we can just utilize supplemental oxygen instead. So pain. You are going to have pain after your procedure. This is normal. What we want to be the goal is for you to have tolerable pain. So when we think about it, having no pain is an unrealistic goal, but having tolerable pain is a realistic goal. So when we think about managing your pain, you're going to give it a number. So this is a scale at the bottom of the screen that you see here. It says 0 to 10. So if we look at 10, 10 would be the worst pain that you've ever experienced in your life. You want to compare it to that. So if you're a 3, 4, you want to give that number. So if it is the morning after your procedure, you will actually have a formal physical therapy assessment, and you will want to make sure that you tell your nurse what your pain level is at that time and what it is when you move around so they can medicate you adequately. So the nurses use a medication administration record to give you medication. So based on the number that you give them, that is how they medicate you. So if you say that your pain is a 4, usually the medication they have is between a 4 to 6, so they're going to give you medication within that parameter. So make sure that you adequately tell them what your pain level is so they can give it to you the right medication. So on the unit, in your room, you all have private rooms, but you will actually have this communication board that's there. And this board, we don't use dry erase boards anymore to let you know who your nursing staff is, who the physician is, when you've had pain medicine last. We actually use this communication board that shows you who your surgeon is, which you should know this, but it also shows you what your goals are for the day. So obviously walking is going to be one of your goals for that day, and it even shows you who your charge nurse and who your tech is. So you can actually utilize the screen to know things, and that you can find out information from just looking at your board, even for goals for the day if you have to do any type of x-rays or testing. So these are devices and equipment that you will see after surgery. So the first picture that's here, this is called an incentive spirometer. The incentive spirometer is actually utilized to help you from preventing postoperative complications, including pneumonia. So, you may have heard it called atelectasis. So with the spirometer, you actually use it to fully inflate your lungs. So we're going to show you how to use this machine, but when you've had pain medicine does not let your lungs expand like they should. This machine forces you to breathe correctly so you don't have any junk or congestion set up in your lungs. So it's a very important tool, and you'll continue to even use it at home. The second device that you see here, this is called a Polar Care. So this Polar Care machine keeps continuous ice water to your back. If we think of it, it helps with inflammation and pain control. It is yours to keep, and you will take it home from the hospital with you. It does require both components to circulate cold water, so it needs both the ice and the water to circulate. So very important. You want to utilize it when you get home. It is yours to keep. You do not have to bring it back. The next picture you'll see is a back brace. This will be prescribed by your physician. If they feel like it is warranted for you, you will use this when you're at the hospital, and even when you go home, up to 3 to 6 months, depending on how it is ordered. It is a physician-specific preference, so it is if they want you to have it or not. When we think of the back brace, we are not going to wear it in the bed, but we're going to wear it anytime we're upright more than 5 minutes. If they do not provide it for you at TOC, we will actually give you one at the hospital, and physical therapy will fit you for it. The next picture you see here, where the patient is lying in the bed, this is called an SCD machine, or sequential compression device. With this machine, it actually helps pump your calf muscles every 10 seconds, and they alternate. So with this machine, the goal and the focus of it is to prevent blood clots. So it is very important for you to wear these when you're in the bed. The next is a Foley catheter. You may or may not have one of these post-operatively. It really depends on the physician orders, but if you do have one, it typically is removed as soon as possible for least of a chance of infection. So if you have a cervical disc fusion, you may have the next brace that you see here. It is called a Vista collar. If you do have one of these, you're going to want to wear that even in the bed anytime, just because it helps you from keeping that good neutral position of your spine. So if it is ordered by your physician, you want to make sure that you wear it at all times, especially when you're up moving around. The next picture down here, so you have ice packs. Ice is very important to help with inflammation. So if you are a cervical spine fusion, you're going to need the ice packs to help with inflammation on the front of your neck. If you actually have any type of swelling, it's going to help with that. And next, you'll see the next photo will be the heat packs. So when we have an anterior disc fusion, we can actually put heat on the back of our neck to help with muscle spasms, and it will also help a lot with your pain due to positioning of the surgery. The last picture is going to be something that only your physician can prescribe for you, but it is a soft cervical collar. If your bone density is still good, they may allow you to wear this in the bed and while you're eating. If not, you'll have to wear that hard Vista collar all the time, so it's going to be a physician preference. So the day of your surgery, things that are important just for you to remember, you want to leave your valuables at home. When it comes to your valuables, we are not responsible for those, unfortunately. And we would, if we do see anything of value, we would actually check it in with our security guard. So it's very important that you keep those at home. Make sure you wear loose-fitting clothes because we want to be able to access your surgical site. We want to be able to look at those and make sure everything is healing properly. If you want to bring a robe or non-skid socks if you're staying overnight so that you can feel more comfortable, and you can wear your own clothes. So it's very important. We want you to feel comfortable. And also your cell phone and charger. These are very important items that you will want to use when you're here. And again, we are not responsible for your lost belongings. So after your surgical procedure, the physician will close in two kinds of ways. So they will either close with staples or with Dermabond. When it comes to the staples, you really want to pay close attention. As long as it's actively draining, we want to recover that after surgery. So usually if you stay inpatient, the nurses will change your dressing, usually post-operative day 1 or 2, depending on how it's prescribed by the physician. So we'll clean with soap and water. We want to use something that's antibacterial. So we want to use Dial soap, which is skin friendly. We don't want to lather a washcloth, pat it on there, rinse it real good, clean and dry, then pat it real good, clean and dry, then recover it. With the Dermabond, however, though, you actually have a little more free range. You do not have to recover it unless you want to for comfort. So with that Dermabond incision, after we remove the surgical dressing for the first time, you can actually leave it open to air if that's what you so desire. When we think of showers, we want to be in there, as quick as possible. We're not going to submerge in water, so no bathtubs or pools, but you can actually get in a shower and you want to be in and out as quick as possible and make sure that you clean the area the last, your surgical site. So do's and don'ts after surgery. Make sure to transport in a larger vehicle. Sometimes it's hard to get in and out of a small vehicle, especially if you're having to bend down. We want to avoid that bending, lifting, twisting. So we want to make sure that we're adhering to our precautions. Typically after surgery, especially if you have a spinal fusion, you want to avoid blood thinners over the counter. Your surgeon will give you specific instructions about that. Just make sure that you listen to their and adhere to their precautions. No driving while on pain medication. This is a biggie. So we want to make sure we do not drive until instructed by our physician. Wear necessary braces at home. This is very important as to, adhere to the strict spine healing. We want to make sure that we're not avoiding any of those movements that can impede our healing of our spine. Continue to use your incentive spirometer at home. You want to follow up in 3 weeks. This is very important, and they will give you a follow-up appointment at your pre-op appointment at TOC. Use your Polar Pack and ice packs to help with inflammation. And of course, ACDFs again. You can use heat, and you can use on the back of your neck, and you can use ice on the front to help with swelling. And again, just kind of reiterating some points throughout this presentation, you'll want to make sure that you eat a well-balanced meal. High fiber can help with bowel movements, as well as drinking plenty of fluids, and then high protein for wound healing. Exercise 2 to 3 times a day. Your surgeon will give you specific instructions on how often they want you to exercise. Do not take alcohol or do not drink alcohol when you're taking pain medication. Do not drive while on pain medication. And this is my contact information. So I have an office number of 850-325-5376, or my cell is 850-966-0580. If you have any questions or concerns, please do not hesitate to reach out. When do we call the doctor? When is it important to know? So typically after you have pain medicine, you may have that facial flushing feeling. When it comes to facial flushing, it sometimes is just a side effect of the pain medication. You may not be running a true temperature. So it's accurate to get a true temperature at home. If it's greater than 101.5, we do want to reach out to the provider. If we have severe pain that is unrelieved by our pain medications and muscle relaxants, if you're not able to pee within 12 hours, this is a medical emergency. Unrelieved constipation for greater than 4 days, increased pain, swelling, redness, or drainage from your incision site. Your surgeon may even want you to come in to see it, or they may want you to send them a picture. Calf tenderness or swelling. So this is a sign of a blood clot. So this is very important. If you have any chest pain, shortness of breath, or difficulty breathing, this is a medical emergency and you'll want to go to your closest emergency facility. Again, I am your representative here at the hospital. I am your spine navigator. If you have any questions or concerns, please do not hesitate to reach out. And I hope you have found this video informative. And if you have any questions, don't hesitate.